It is estimated that 1 in 5 people in the United States are affected by mental health disorders each year, and that over half of individuals living with HIV and AIDS are affected by mental health and/or substance abuse. Mental health and substance use disorders among HIV-positive individuals can affect quality of life, decrease medical adherence, and lead to negative health outcomes. Often, people who are having difficulties with mental health or substance use don't realize what is happening. It is very important that you share what you are experiencing with your medical provider so that he or she can help you get the necessary help and treatment. Making sure that mental health and substance use disorders are addressed effectively is vital to living a healthy life with HIV. If you or someone you know is HIV positive and has mental health or substance use concerns, please encourage them to contact an HIV medical provider or a mental health or substance abuse provider. There are resources that can provide assistance. Thanks for watching.
Come in.
Good morning. Really glad you made it in today. How you feeling?
Doc, I mean, overall I'm okay. I really haven't been sleeping like I normally do, but I'm okay.
Well, sleep's really important, so that certainly can make you not feel well. Have you been worried about coming to this appointment or something?
No, not really.
Well, that's good, because I wanted to tell you before I came in, I took a look at your labs, and you're actually doing really well. Your viral load has gone way down, and that tells us that you're taking your meds and things are looking good. It's really a big improvement from last time.
Okay, well that's definitely some good news in my life.
That's
so, yeah.
really good news. How would you say your mood has been lately?
Well, first of all, when it comes to moods, first of all, I sit up at night and I think about the same thing over and over, which causes me to worry. And then, I've been really snapping at people, and Doc, you know me, I'm always goofy, silly, but lately I've been snapping at people and really saying to myself, and which that causes me, especially when I'm by myself, I'm more sad than I would be. I'm sad and kind of don't know where that sadness is coming from. I really haven't had an appetite, and we always talk about eating and how I love to eat. So
yes, I should check that.
So I just haven't had an appetite for some reason.
Yeah, on here I'm noticing that you've actually lost about 5 pounds since your last visit.
5 pounds?
Well, wait a minute though. Let me ask. Were you trying to lose weight?
No, that's the problem.
The
I haven't really
okay.
been eating.
Okay. Well, there's lots of things that could cause the symptoms that you're talking about right now. But I feel fairly confident that it's not your HIV. We've just gone over all of your lab results. Everything looks really good. I'm wondering if there's something else going on with you. Would it be okay to ask you a few more questions? Yeah, so in reviewing what you've said today, it sounds like you're having trouble sleeping, you're not quite feeling like yourself, okay, so kind of sad and irritable.
Yeah.
How about your energy level, your motivation? Are you still doing stuff that's important to you?
Well, I did play soccer 3 days a week, but I don't know, it just felt like no energy, and I thought it was because I wasn't getting any sleep. Earlier I told you I wasn't sleeping, so I figured maybe that's why I'm not really doing any energy or activities.
Right. Well, that could be. Certainly if you're not getting sleep, that can make it hard to do other things. But I'm a little worried that maybe something else is going on. From everything you're telling me, it really sounds like you might be dealing with some depression. I really think it's important that we get an assessment done. Would you be willing to meet with somebody?
Doc, depression, really? No. You trying to say I'm crazy or something? I'm not crazy.
It's not about being crazy. That's not what this is about.
Okay.
This is making sure that we're addressing everything that could possibly be going on with you. We've done a full physical assessment. I've looked over all your lab results. Everything looks really good, so I don't think that's what it is. If we don't assess all of it, you may go on feeling like this or even worse. And that could even affect your physical health. People stop taking their medicine, they stop coming to appointments. You've already stopped doing some of the things that are really important to you. What do you suppose will happen if you go on feeling like this? It's just as important to take a look at your mental health as well. And that can be assessed just you meeting with someone and talking to them about what's going on. Would you be willing to do that with you? Can I get you set up for an appointment with somebody? We have somebody here you can talk with.
Yeah, I think I can kind of go for that because I don't think I could go on any further the way I mean, I've been trying to handle it on my own, like I said,
absolutely.
but yeah, I just can't do it anymore by myself. So, yeah, you can sign me up. I think I can be down for that. I can't go on like this, so.
Yeah, and you know, I know it's hard to kind of think about this or even to take a step in this direction, but the truth of the matter is we've got some really good treatments available. We just need to get to the bottom of what's going on at this point. It's as easy as setting up an appointment with somebody here in the clinic, somebody to talk to. They're just going to ask you questions and do what we're doing here today, and they can figure out what exactly is going on and then give you some information about ways to feel better. Okay, if I go ahead and set you an appointment?
Yeah, you can sign me up. I think I can be down for that.
Okay, great. I think that's a really good idea. We'll get that done. I need to go talk to somebody, get that appointment set up for you. If you want to go ahead and get undressed, I'll step out of the room and be back in just a few minutes.
All right.
I think you're doing the right thing.
Thanks.